Welcome to this interview. Dr. Muyuni, could you tell our listeners who you are and what you do?
Thank you very much. I'm Dr. Mutinta Muyuni, obstetrician gynecologist.
Right. Dr. Muyuni, I'd like you to address the issue to do with fibroids. What are fibroids?
Fibroids are a very misunderstood, harmless kind of growth in the uterus. That's simply what they are, harmless growths that are growing in the womb or the uterus.
Could you expand on the harmless part? Why do you say they're harmless?
They are harmless because they are not cancerous growths. However, they can be a nuisance.
Okay.
Some people go all their lives without knowing they actually have fibroids and only find out after they pass through certain life experiences. They find out either coincidentally when they are being checked for something else or due to their presenting problems. They then find out that they have these growths. So I term them as harmless because they are not cancerous. But their effects on various women's lives can be quite challenging.
Okay. So what are some of those effects that you say are challenging?
Okay. So to start with, what would bring me to the hospital to check if I've got fibroids? Some people are not symptomatic, meaning they have no complaints. So there's no harm in checking to find out if you have them. A pelvic scan at any of the local clinics or hospitals will reveal whether you have fibroids or not.
Okay.
Some of the other complaints that a woman may have is extremely heavy periods, such that the bleeding may affect your quality of life, resulting in anemia. It may affect your quality of life because it's so heavy that you are unable to work properly, to the extent where some women may actually use diapers instead of normal sanitary pads because of how heavy the period is. In some instances, women also have severe period pains, crippling period pains that may require them even to come to hospital for pain relief. Some women may have constipation or increased frequency of urination, or to put it in a better way, it doesn't take them long before they need to pass urine again.
Okay.
These two, constipation and frequency, go hand in hand. They are to do with pressure. If you've got something pressing on the bladder, you'll need to pass urine. If you've got something pressing on your intestines or on the rectum, you'll find that after some time it becomes hard for you to pass stool. And so this explains the constipation and the frequency. Some people also have back pain from the heaviness of the period or the heaviness of the fibroids, which can even range from a few grams up to 5-6 kg. And so some women have backache as one of the presenting symptoms. Depending on the location of the fibroids, they may result in infertility.
Okay.
Because some may be submucous or on the inner part of the uterus. Some may be subserosal or on the outer part of the uterus. Some may be right within the womb where the baby is supposed to be growing. As a result, one may even encounter recurrent miscarriages, premature delivery, growth restriction of the baby because the nutrition is inadequate because of the location of the placenta, perhaps over a fibroid or something like that. So these are some of the challenges that women with fibroids may present with. And some, if you have some of these complaints, it would be wise to just seek attention to see how your quality of life can be improved, as opposed to just managing the situation and, suffering in pain, suffering with anemia, suffering with prolonged periods. There's always help. But as women, because it's something to do with reproductive health or our private areas there's always this taboo or stigma surrounding prolonged bleeding. And so I still urge women to reach out and find out if this is because of fibroids, or could it be this cervical cancer, or what is causing their problem to start with.
Right. So you said there's help. What are some of the treatment options that are available in Zambia for fibroids?
Okay. In Zambia, we can put them into two broad categories. You can have conservative management or surgical management. I'll also go into some of the surgical management that are available in other areas that may not be available in Zambia. So conservative management will be, I will not operate on my fibroids. I'll not operate on my fibroids, but I will take medication, say, to minimize the bleeding.
Right.
Take medication for pain to relieve the period pains. Those are some of the conservative management. I'll add here perhaps a caution, because you see even on Facebook, internet, newspapers, so many herbal remedies that people propose for treatment of fibroids, claiming they will vanish. There are certain medicines that will shrink fibroids, but when you shrink them, it should be with a view to have them operated on. Because sometimes we shrink fibroids so that they are small enough for us to operate easily without the woman having to lose her womb. But sometimes people take this as a cure. The medicines or even the herbal remedies, they play with the balance of your hormones. We know that fibroids tend to thrive, or they grow in a rich hormonal environment. And so this is the reason why even after your menopause, when your hormone levels go down, the fibroids tend to shrink. But if they are large, they will shrink to a certain level and then remain at that level. They may not vanish completely. So a lot of women say, I'll try this and that, and a lot of people have spent a lot of life savings trying remedies that may not even be of help. And I would just like you to caution people. I always give people a chance to try what they want to try. And I've told those who feel they have had success to come back and tell me, so that I can also inform other women what has worked well. But I'm still waiting for the patients to give me feedback. Clearly, this is a sign that a number of these herbal fibroid remedies are to be taken with a pinch of salt.
Right.
And so each woman with fibroids should know their own situation and not hearsay from others what happened to them, but they should seek their own individual based care. And so pain relief, trying to limit the heaviness of the blood flow, management of conditions like anemia. We may give some hormonal therapy also to stop the bleeding. We may also give you blood boosters like iron tablets so that you have a good reserve. We also encourage, particularly working women, your eating habits are not good. And so battling anemia is a particular challenge. We urge you to eat well, take plenty of fruit, plenty of fresh veg. That will boost your blood levels so that even if you bleed heavily, you don't necessarily become severely anemic. Also, under the conservative management, someone may ask, amongst those who don't have fibroids, but perhaps it's there in their family, how do I prevent? prevention is very difficult because even the way fibroids developed is not clearly understood.
Right.
There may be a genetic component. Some talk about growth factors in the body. Some talk about hormonal influence. But at the end of the day, the take-home message is they are difficult to prevent. However, if each one of us adopts a healthy lifestyle, this will go a long way towards helping us manage them or avoid them, if at all that is possible.
Are there known risk factors for fibroids?
Those people who start, the women who start their fibroids at an early, their periods at an early age, that's a risk factor.
Okay.
Also, black race are known to be more prone to fibroids than other ethnicities. Risk factors may be there. For example, your mother had fibroids. You may find that daughters have also taken it up.
Okay.
That may fall under the genetic component with regards to fibroids. So these are some of the risk factors that are well known, as well as those people who have not had childbearing. Some people by choice, for example, women of the cloth or nuns, it's also common to find fibroids in these populations.
Right.
Yeah. For surgical management of the fibroids, we have options, and these options will also depend on the size of the fibroids and also the desire or of the woman to have children. Okay. For example, if a woman presents with severe backache, she is past menopause, past childbearing, bearing in mind, and this is a critical point, a uterus is used for childbearing. That is its function in our body. And so a lot of women also feel very wary of the possibility of losing that organ. The fear of losing a womb, even if it is causing you crippling problems, should be considered from the perspective of the function of that organ. If I'm past menopause and I'm advised, for example, for hysterectomy, because I can't have children anyway after menopause, then my fears should be allayed. I know also women feel I'm not complete if I do not have my womb. But there is more to women than childbearing. And we should strive to feel complete with or without our wombs. If a womb is causing more trouble than it's worth, then surgical removal may be an option. So one of the options is hysterectomy or removal of the entire womb. In some women who might not have had children, this may be necessitated not by choice, but because the fibroids are massive. And I'll come to this again. Because for women who have not had children, there are other options, such as uterine artery embolization, blocking the blood supply of those fibroids and allowing them to slowly shrink over time. However, such options are available in South Africa, India, not yet available in Zambia, but I'm sure will be on your way soon, because we now have a cath lab at UTH, for example, and so we should be able to in time do these embolizations or blocking the blood supply of these fibroids. The other surgical option, apart from removal of a uterus, is removal of the fibroids themselves, or myomectomy. Now, during myomectomy, there's always a risk of ending up with the womb removed, but surgeons always strive to consider. No surgeon will risk your life or allow you to bleed to death on an operating table just to save your uterus. If the operation is not going well, they would rather remove the womb than allow you to pass on. But removal of fibroids is our first choice in women who have not had yet children. Now, another caution is try and do these operations in hospitals where blood transfusion facilities are available or intensive care facilities are available. Don't just do them in, these small hospitals with questionable credentials. These are done at most of the big hospitals in Lusaka, and I think with successful outcomes in most cases. So the trick is, at the end of the day, is to seek help early. Now, doctor, one may ask, fibroids still grow back?
Yes,
it's not really that they grow back more than that the small microscopic ones that were not seen at the time of the surgery have grown to full size. So then when someone identifies a small fibroid that was there, supposing the size of mincemeat, then it grows big, they say the fibroids have grown back. No, the fibroids that were removed will not grow back. But there may be some smaller ones that were not seen by the naked eye that will grow to full size. However, having the surgery will still help you in terms of the symptoms. If you are not able to conceive after the fibroids are removed, at least your periods will be better, your constipation will be better, your backache will be better. The removal of fibroids can be done in open surgery, which is available over most of the Zambian provinces, where a cut is made on the abdomen and the fibroids are taken out by hand. The other option is using laparoscopy, which is largely available only here in Lusaka at selected hospitals, where certain instruments about the size of a pen are used to remove the fibroids, and they are delivered out through smaller openings with a quicker recovery time. In addition to the laparoscopy and the open surgery, I think those are the main modalities of treatment. These may be preceded before by medical treatment or hormonal therapy to shrink the fibroids.
Before you go into
Before you go in. So when you see the fibroids have shrunk, don't vanish. Complete the process.
Yeah.
So this is the mainstay of treatment of fibroids in Zambia. And I hope someone somewhere will find that information useful.
Oh, thank you very much. Any final word to our listeners in terms of, particularly on this issue of fibroids? What is your take-home message?
Take-home message is go and get checked out, and don't take it for granted that all women have heavy periods, all women have period pains. Look at your quality of life and then seek help.
Good. No, thank you very much, and I'm sure our listeners will be, and our viewers will find this information useful. And thank you for coming through, Dr.